Firstly, I will begin with doing a physical exam. I have already done a full body exam where I have checked the heart rate, respiratory rate and temperature, and everything seems normal. I have asked the owner if the patient has been eating or drinking normally, any signs of pain coming from the mouth, and if the patient has had a dental before. I will do a facial examination where I will check facial symmetry. I will check the capillary refill time and mucous membranes where they should be pink and less than 2 seconds. I will check for malocclusions, and the temporomandibular joint for any resistance and clicking of the jaw. I will also check the lymph nodes for size and symmetry such as the submandibular and prescapular. I will then check the oral cavity for any odor. Then I will examine the tongue, hard and soft palate, and gums for any abnormalities such as bleeding and lesions. Using the instruments I will check for any missing teeth, fractures, gingivitis, plaque and tartar. The instruments I will be using are the calculus removing forceps, the hand scaler and curette, periodontal probe, periodontal explorer, also known as the shepherd's hook. Before each instrument is used, it is important to check that they are sharp, sterile and clean to avoid infections and have an efficient procedure. Each instrument must be held using a modified pen grip using a C-shaped grasp on the instrument. The wrist should be in a neutral position using minimal pressure. This is to stop pressure against the teeth as this could lead to breakage. Firstly, I will use the periodontal probe. This has lines on the probe that represent millimeters. It is used to check the depth of periodontal pockets as it can access the space between the tooth and the gum tissue. It can also identify gingival recession by measuring how much gum tissue has receded. Furcation exposure can also be checked. By checking for pockets, I will gently place the probe around the gum line of the tooth. For a singular root 2 times, for a dual root, 4 times and a triple root 6 times. I will use 25 grams of pressure max. I will also do this on the lingual and palatal side of the teeth. I will then use the periodontal explorer, which is also known as the shepherd's hook. I will use this instrument to identify any abnormalities found on the surface of the teeth. It allows a physical examination of the teeth but with light pressure. It can pinpoint abnormalities such as roughness of teeth, which could indicate plaque and tartar. It can also identify fractured and broken teeth, cavities and lesions. I will do this by lightly dragging the side of the shepherd's hook on the surface of the teeth. I will then use the calculus removing forceps. This removes calculus and tartar from the teeth. I will use the forceps by placing the curved side of the instrument on the gingival but being mindful of the gums. This will be placed just below the top of the gingival. This is subgingival. The other side is then gently resting against the posterior side of the tooth. By squeezing the instrument, hopefully, the tartar will snap off or become loosened from the tooth to then be removed. The calculus removing forceps are usually used for larger teeth such as canines, molars and premolars. It is important to be careful during this process as the teeth might break. I will use the hand scaler and curette. First, I will use the hand scaler. This instrument is used to remove dental deposits such as plaque and tartar. The hand scaler is used to clean above the gum line, which is supragingival. The hand scaler is sharper and more pointed compared to a curette. This makes it good for removing built-up plaque and calculus. However, since it is a sharper tool, it is important that it must be used by pulling away from the gingiva, as this can cause injury to the gum tissue. The gingival margin may become damaged. I will then use the curette. This instrument must be used subgingivally, which means below the gum lines. It also removed plaque and tartar from the teeth, but that is located below the gum line. The instrument should not be used above the gum line, as this can cause lacerations on the tissues. This instrument also removes plaque and tartar from the teeth. The sharp edge of the instrument should be used against the tooth surface. I must use this instrument by pulling away from the gingiva. This instrument is rounder and not as sharp compared to the hand scaler. This allows the curette to work safer around delicate areas such as the gum tissue and tooth root. This prevents causing damage to the tissues due to being a lot less sharp. It should not be used below the gum line, as it can cause lacerations to the gingival. I will then record my findings on the dental chart. I am recording my findings of the left side of the maxillary and mandibular. From my findings, I have identified that this skull is a mesocephalic. On the mandible, 307 is a missing tooth. 205, 304 are fractured teeth. There is a crown fracture on the tooth 308. There is osseous recession in the teeth 208, 301, 302 and 303. There is overcrowding of the maxillary incisors. This includes of 201, 202 and 203. The gingivitis index is 2. The plaque index is 2. The calculus index is 2. The occlusion class is 1. I will then move on and use the powered dental instruments. First, I will begin by wearing the correct PPE, which includes of safety glasses, a mask and gloves. I will ensure that the machine is switched on at the wall and on the machine. I must make sure there is a sufficient amount of water that will last me through the whole dental, as it can be unsafe if I run out of water during the dental. The water keeps the instruments cool, so they do not overheat and burn the patient. I must also have a kidney dish that will allow me to test the instruments without getting water everywhere along with a towel. I will now check the powered dental instruments. Before each dental is performed, these instruments need to be checked to ensure they are working and functioning properly. Each powered instrument must be clean and sterile. I will begin by testing the low-speed handpiece. Factors that I am testing for is the operation of the handpiece and how it is working. I am ensuring the instrument is running smooth. I will also check for heat to ensure that the instrument hasn't heated up during the process. I will also check the air pressure and water and that there is plenty lubrication. I will then check the three-way syringe. I will check the air pressure, then the water pressure and then both combined. This is to check that both functions work individually and then together. I will then test the ultrasonic scaler. For this instrument I will check that the water is working during the use of the instrument. The ultrasonic scaler must be kept moving and cannot be held on one area of the tooth, as the heat can build up and burn the tooth, which can damage the enamel. It also must be used with light pressure. It is important to use the side of the tip and not the pointed sharp end. Each of the powered dental instruments should also be held with a modified pen grip, the same as the other instruments. For each of the powered instruments, the connections should be tested to ensure everything is properly connected. There is no abnormal noises when each instrument is used, such as squealing. There must also not be any jerky motions to the instruments and that they should be running smoothly. Now that I have tested the instruments, and they are safe to use, I will begin by using the ultrasonic scaler. By using the ultrasonic scaler, I must ensure that I constantly keep the instrument moving. I must not hold the instrument in one place, as this can damage the enamel. I will do overlapping strokes down the tooth to ensure nothing is missed and so that the enamel is not damaged due from constant pressure in one spot. I must also press lightly, as if I press hard this will create heat. It also prevents the scaler from vibrating, which is how it removes plaque. If the instrument is unable to vibrate, it cannot work efficiently. I must use the side of the tip and not the pointed sharp end, as this can also damage the tooth and the gums due to the sharpness. I will only use this instrument subgingivally. I must ensure during the process water is flowing through the tip to stop it from overheating and rinse away the plaque, debris and bacteria that is being removed off of the teeth. I will do this to the surface of the teeth that are buccal and then to the surface of the tooth that is labial. This hand scaler is used to remove plaque and calculus. The high-frequency vibrations dislodge the plaque to help remove it from the tooth. Water also helps this process through cavitation. Now I will use the three-way syringe. By using the water and air together, this will wash away the plaque and calculus that has been removed by the ultrasonic scaler. This will also wash away any debris, bacteria, blood and saliva that needs to be removed. This keeps the mouth clean and also visible to see, as it is removing anything unwanted. The air can also be used to dry the water and helps before polishing the teeth. If I would like just water, I can do this by pressing the water button, or if I want just air, I can press the air button. I will press both buttons at the same time if I would like both to be used together. I will direct this at the tooth and not the gum, as this can damage the soft tissue if it is used closely with full pressure. Once I have finished rinsing with water, I will dry with just air. I have not shown this, but I would do this next time. I will now use the low-speed handpiece. This is used to polish the teeth at the end. I will begin by getting the Profi paste. I will make sure I get a sufficient amount. This removed any plaque left on the teeth. It smooths the enamel on the teeth and stops any roughness on the tooth. This prevents bacteria attaching to the tooth easily. This also cleans stained teeth. I will use the low-speed handpiece with light pressure on the tooth. I will do this with slow speed, that is in a circular motion. This will also be overlapped to ensure all of the tooth is covered, however not for long, as this instrument can also heat up and damage the enamel. I will be careful of the gums as it is soft tissue that is delicate. I will also do this to the labial and buccal surfaces of the tooth. I will then rinse the Profi paste off once I have finished with the 3-way syringe.